Richard, could you tell us about yourself?
So my name's Richard Onion. I'm a consultant psychiatrist. I work in an early intervention in psychosis team in South Warwickshire. I'm also the Associate Medical Director for Community Mental Health Services.
And how did you come to work with the trust?
So I originally came here in 2007 initially to do a locum job, and I liked it so much that I'm still here 12 years later.
And what made you like this trust? What was different?
I think there's lots of things to like here. So I've worked in a bunch of different teams in inpatients, in crisis and in the community, and I've always found the colleagues I've worked with really professional and supportive, so there's a really good ethos of multidisciplinary team working here. I've also found the relationships with consultant colleagues really good, so it's very supportive, it's very easy to discuss cases, it's good for professional development, and it's just a friendly place to work.
And has the trust provided you opportunities and chances to enhance your career?
Yeah, there's lots of different opportunities that have come along since I've been a consultant. So initially I've worked in undergraduate education and research and had a role at the medical school, and then more recently I've moved into medical management and leadership roles before coming to do my current job.
What's been the most favourite part of your current job?
I think my favourite bit of my current job is the team I work with and some of the patients that we support. So it's a very satisfying area to work in, early intervention in psychosis, in that you see young people who've been through some very difficult and traumatic experiences, and you get to see them over a period of 3 years, and most of them make lots of progress during that time, and we have really good outcomes. And during that time you do that with some really great colleagues.
And in terms of your management role, we know that NHS and Trust is going through a lot of changes. Is there anything that really excites you about these times?
They definitely are. They're challenging times, but exciting times as well. So although money's been tight for the past few years, which is true across the NHS, some of the relationships we've got with our partners locally are really good. So we've got really good relationships with the local authority, with our commissioners, with GPs, and we've started to see lots of new investment coming along now. So in early intervention in psychosis and our perinatal mental health services, and then hopefully over the next few years in our core services and CAMS.
Okay, pause. And what is either your least favourite part of the job or a challenging part of your job?
I'm not sure I have an answer to record about that. I think probably the thing that's most difficult, and my guess would be lots of doctors say this, is just the volume of stuff that there is to do. So although the clinical work's really satisfying, it is busy, and it's sometimes hard to balance that with other roles, whether that's academic roles or leadership roles. But it is satisfying to do all of them.
On those lines, what is one of the achievements that you are really proud of?
I think the thing I'm probably proudest of recently is the way we've been able to work with our colleagues at the CCGs and local authorities to get new investment for some of our services. So we've gone from having really quite a minimal perinatal mental health service to really quite a big team offering a comprehensive service now, and then we're also seeing quite a lot of investment recently in early intervention services, and we know that over the next few months that we're having quite significant investment in our crisis services, and all of that allows us to deliver a much better service for patients who really need the support that we offer.
And what would you be looking for in a potential applicant for a new consultant job?
Well, the consultants are the key to our services. So I think the most important role consultants play is the one of being the clinical leaders of the teams, and we see that with our community teams. When there's a good consultant there, the whole team just works more effectively. The rest of the team feel supported, and those teams then make progress and improve the quality of the care that they deliver. So primarily I see our consultants as clinical leaders. and lots of them bring lots of other skills and expertise as well, which enhance the trust, enhance the medical school, and enhance the health of people in Coventry and Warwickshire.
Okay. You just mentioned teaching. So what are the opportunities for people joining the trust around teaching?
Well, we're a teaching trust, and we teach both undergraduates and postgraduates. So we're the main leader for education in psychiatry for Warwick Medical School. We also get medical students from the University of Buckingham as well. So there's lots of opportunities for new consultants to be involved in that, as much as they want to be, really. So that could be from being a clinical teacher and having students on placement. It could be doing small group teaching and lecturing, up to taking kind of honorary associate professor roles, which some of our consultants do, and having more of a tutorial and organisational role with the medical students. We've also got our own core training scheme for psychiatry, which is really well subscribed at the moment, and we've got some fantastic trainees coming through the training scheme. And there's roles around being college tutor and other roles linked to that through the School of Psychiatry.
Okay. And what are the opportunities available within the trust for new consultant or consultant joining in terms of research or managerial roles?
I think that there's opportunities for both research and management in the trust. So in terms of leadership roles, like as I said, there's I might have to say that one again, sorry. So there's lots of opportunity for consultants to develop themselves. So one area they can do that in is in developing themselves as clinical leaders. So we'd expect all the consultants to be clinical leaders of the teams that they're in. But lots of our consultants take on more formal leadership roles than that, and we've got quite a big medical management team, and that team do a really diverse set of roles. So some people are involved in appraisal and revalidation, some have more operational management roles, and there's the opportunity to work with other agencies and commissioners as well in developing our services. There's opportunities as well for new consultants to get involved in research. So we have a research and development team within the trust led by Professor Swaran Singh, who's also the lead of the Faculty of Psychiatry at the medical school. And there's lots of opportunities to get involved in research at all different levels.
One last question. Why this area?
Well, Coventry and Warwickshire is a great area to live in. So I'm based in South Warwickshire, and that's got some fantastic towns. There's Leamington Spa, there's Stratford upon Avon and Kenilworth. But across our whole patch there's loads going on. So Coventry is a really vibrant university town. There's lots of young people around. It's going to be the city of culture next year. So there really is loads going on. There's something for everyone in the area, whether you want a busy sort of urban lifestyle or a quieter rural lifestyle like the one I prefer.
Okay. Anything else? I think, yeah? Anything you want to say that?
Anything else?
No, I only don't say anything spontaneous.